Hey y'all, I want to share with you all why I've chosen to do IVF, why it seems to be the best option for me, and why what led me and got me here. I I've been trying to conceive naturally. Um, I started April 2016, and I believe it was 16. It just seems like so long. Um, and I actually had no success after several tries over the course of maybe 9 months. Um, I thought about going to a facility and trying IUI, which is what we, you know, usually say with artificial insemination. Intrauterine insemination is one of the options available. But I chose to skip directly to IVF, although it originally was not something I wanted to do. I felt like, hey, well, this is my first kid, this is my first try, let me just try naturally. And, I don't think there's anything wrong with me. So, several times, no luck. Then suddenly there was an ER visit. I was having extreme abdominal pain. I wasn't able to empty my bladder. I felt like it was gas moving around, lots of sharp pains. And so I go to the ER, and this is November of 2016. And I discovered that I had fibroids. I discovered in October of 2016. And by November, I was seeing a gynecology specialist, and he specializes in that whole area. So, very nice, very kind doctor. I told him what I was wanting to do and what I was trying to do. And, I had been to Fertility Institute prior, which was 3 years ago, and I got my egg count then. And back then, my egg count was 0.28, meaning less than 1, 0.28, as in out of $1, 28 cents. So, I was told that I needed to get it looked at, get an MRI, see how big they were and where they were. They were small, but they were in some spots that could have caused some problems. But when he looked at them, he saw that they weren't big enough necessarily to need and require surgery immediately. I told him what I had going on, so it was important to me that, it be fixed if it needed to be fixed. So he told me to keep trying. I tried a couple more times and nothing. So he said, if it doesn't work, come back to me. I went back to him. He regulated my cycles, and he gave me tranexamic acid because I had heavy cycles and just did not realize that I should have said I'm experiencing heavy cycles. I just thought it was just normal to have a heavy cycle. Some do, some don't. So thank God, no endometrium. I don't know. It's so many words in my head. I don't have endometriosis. Maybe I should just say that. So he actually tried to work with me as much as he could. He was very positive. I loved his professionalism and whatnot. And he says, come back if you're not getting anywhere. So the tranexamic acid really worked, lightened my cycles. It was much less flow. I was very comfortable. Came back to him and he's like, okay, well, since it's not working, let's run some more tests. So had an MRI done, another MRI, and a biopsy. And thank God the biopsy came back with no cancerous cells and no precancerous cells, which was a great thing. But at that point, he saw that the fibroids were getting slightly bigger. And one in particular is right down the middle, right in the center of my abdomen, right at the top of my cervix, and right at the uterus. Is the top of the cervix? Yeah. Somewhere, it's just right in the middle. So, so much so that he's like, this is as far as I can take you. You need to go see a reproductive endocrinologist. They will tell you what your next steps are, if you need to have them removed, if you can move forward with a pregnancy without having them removed. So it was November 2017 by this time. And a couple of more natural tries had not worked. And I started right away looking at insurances, calling around to different fertility places to see what type of insurance they accepted, what was the best one, which one covered the most, balancing that with what I could afford, picking a plan that would cover IVF, if not most of those things, had a decent deductible that I could choose, and a rather modest out-of-pocket maximum. So with all those variables, within that short 6 weeks that we had to register for insurance, I managed to do it before the deadline. I called the place that I searched for in Chicago here, and I was like, are you accepting new patients? This is the insurance that I have. How soon can I see a reproductive endocrinologist? I did a little bit of background check on the doctor, read her reviews, read the office reviews, and I chose to go with them. And I'm so glad that I didn't have to search long, because I absolutely love the entire staff at VIOS Fertility Institute, VIOS Fertility Institute. And the location that I go to is in the Wicker Park area of Chicago. My doctor's name is Dr. Ruhi Jilani. She is amazing. Her bedside manner, her professional manner, her personable mannerisms, and just getting to know me and understanding that the ultimate thing that I want is a baby, and she wants to get me there. And from the moment I walked into her office, her entire staff, the entire office, they are genuinely personable, kind, and just their mannerisms are very great energy. And they've been on the ball from the top of the first time I walked in that office, with the exception of me pausing for about 6 to 8 weeks to lose some weight. And I lost 24 pounds. Yes. And to save up a little bit more of a stack for my procedures and office visits and medications. They have been ready for me. I never had to wait for them. They were always ready. So she looked at my MRI and my biopsy. She says, okay, this is what we need to do. You need to have a hysteroscopy. That's basically when they go in and they scrape the uterine wall. After a couple of saline sonograms and ultrasounds, they found that there were polyps or fibroids inside where they could not be, where they should not be, where a fetus and those items cannot dwell in the same place without fighting for nutrients and space. So they performed that. And what I was told was, had that procedure not been done, I would have had a miscarriage or preterm labor. This is why I could not conceive naturally, unbeknownst to me. There could be some small things going on with women. There could be some major things going on with women, and this was mine. Being that that was the issue, that explains why I had a chemical pregnancy. It was about, I want to say about a year ago, and I got a positive pregnancy test, and next thing you know, I got a cycle. So I am grateful for my doctor. She has given me every confidence that she has my best interests. She knows, and she's watching my body closely. She's taking my results very seriously and laying out a plan that's working for me. I then proceeded to follow every instruction she gave me. I had my psychiatric clearance, and basically they discuss with you, do you realize that you're picking a father that you don't know? Are you aware of what can happen, what can come up? Do you plan on discussing this with your child? Do you understand if you were to have eggs split up and become a multiple pregnancy? Would you be prepared to reduce the pregnancy if your health could not take that? For example, if one of the eggs split off and I became pregnant with twins and it was a stressful pregnancy and it was causing problems, I would have to understand that I would have to look at and consider reducing the pregnancy, meaning one has to go. How many embryos do I want them? How many embryos will be placed inside? Pardon?
Call from 1-877-221-51746.
I had to go and see a maternal fetal medicine doctor because I am advanced mother age. I am 45. So with that and having another egg count done, I am at 0.24. First one I took said 0.28. So now I'm down to a 0.24. I so wanted her to leave that little 4 attached on, but she's just saying 0.2, and that's fine. Because I know what I need. We just need like 2 or 3. 2 or 3. That's what we need. That's what we need. So I saw the maternal fetal medicine doctor. He asked me several questions. He decided that I am in good shape to carry a healthy pregnancy along with some other recommended regimens during the pregnancy. He also ordered me to go and have a EKG, a 2D echo, and I had those done, and they came out great. Everything read great. My general doctor, my general practitioner is in the loop with this. He's all for it. He gave me his thumbs up. They were all very happy to see that I lost some weight. He wanted me to lose a little bit more, so I'm working on about maybe 10 more pounds. I adopted the keto lifestyle, and that really worked for me. There's lots of controversy about it. There's lots of he say, she say about it. People just don't like it. Some people love it. To each his own. This has worked for me. In 3 months, I've lost 24 pounds and still going. I've lost tons of inches. I lost count of how many inches, somewhere around 14 or 15 inches by now. I had genetic testing done. This key information was how, what played a great part in how I chose the donor sperm. The donor sperm has been purchased. It was purchased back in May. And it's at the facility where I'll be having my procedures done. My genetic testing came back, and I had a counselor to call me and discuss the two carriers, the two things that I am a carrier of. And I had to consider that information when I was choosing donor sperm. So I placed that into the advanced search section. I listed the things that were of a preference for me, and it kicked back 7 profiles. Of the 7, I loved 2. Of the 2, I weighed which one I wanted the most, but the main thing was that if one had enough vials and if the other would run out or whatever, I would have more than one choice. So I know more about the donor than probably anyone I've ever dated. The donor sperm profile comes with an extended family history as far as the maternal and paternal grandparents, aunts, uncles, and of course siblings. So I've got a pretty healthy, handsome donor sperm specimen, and it's an open ID, which means when my child is 18, the donor is open to meeting. So I wanted to choose the greatest option, considering that I am a single mother by choice. I am prepared to tell my child as soon as they are capable of asking and hearing an age-appropriate answer that this is what mommy has chosen to do to bring you to this world. Here's the journals. You can read the journals. Check your YouTube page and watch mommy go through the process. And everything is coming to a point that I have not had to fuss, fight, push, pull, go broke, or anything like that. So I'm determined, and I believe, and I am seeing nothing but me getting pregnant and me having a healthy pregnancy and me having a child. So hoping I didn't miss anything, but I am planning to go live one evening and have a chit chat with you guys so you can ask me questions live and I'll answer them. Again, hoping this helps, hoping this gives you some insight, providing it for yourself or someone else. But it gives me great release of anxiety the more I share and the more I talk and give you guys an inside perspective of what I'm doing and what's going on in my story and my journey. Thank you again, and I'll holla at you later. Peace.